So welcome everyone, thank you for coming. My name is Cathi Dennehy. I'm one of the associate clinical professors in the School of Pharmacy. I've been practicing at UCSF now for about 12 years and gave my very first presentation on herbs and supplements back in 1997. So after that point in time, after that talk, I gave it actually at a national meeting, I kept getting requests from people to do more talks on herbs and supplements, and very steadily it became an area of expertise for me. So much of the information that I'm going to present to you today is really sort of a summarization of evidence, at least in regards to the supplements that we're going to discuss. It's a summarization of clinical evidence that is currently available to either support or refute claims that are made by some of the more popular dietary supplements. So this is an overview of what I'm going to discuss with you today. We're going to talk a little bit about how the products are regulated and how that's different from other prescription and over-the-counter products. We're going to talk about just overall statistics regarding who's using these products and why they're being used, hazards that can result from dietary supplement use, and look at just the top 6 selling products, and finally information resources so that when you have questions, or when if you're a healthcare provider, if you have patients that have questions or family members that have questions, resources that you can go to help answer the questions as they come up. So I want to start out with just a little bit of historical information because I think it's really interesting to look at how we've sort of come full circle in our use, specifically really of plants as medicines. If you look back at the very first pharmacopoeias that were discovered back in 1500 BC, this is Eber's Papyrus, that pharmacopoeia was based on all plant-based medicines. And when you look at the use of plants for medicines today, plants attribute about 25% of the drugs that we use. And a larger percent, 50%, of the products that we use, drug-based products that we use, come from natural sources. So this could be microorganisms, animal-based, plant-based, but overall, just a very large proportion of the drugs that we use coming from natural resources. And that's an important fact, because if we look also at the richest sources of our natural resources, many of these are our rainforests. And, it's quite frightening that it's estimated that about 50,000 species of plants and animals and microorganisms are lost per year due to deforestation in rainforests. So it's definitely an area where you see big pharma, and also you see the National Cancer Institute coming in and trying to preserve, these rainforests and looking at them now as a resource and tool for future drug discovery. Overall, there is a very large population of individuals on the earth who use plants as medicines. The World Health Organization estimates it at about 80%, with the majority in developing countries. Well, when we look at how these products are regulated, it is quite different than how prescription drugs and non-prescription drugs are regulated. And you often hear, at least I often hear, people say things like, oh, well, dietary supplements, healthcare providers might say dietary supplements, well, I don't recommend them because they're not regulated. Well, they are regulated. They're just not regulated in the same way as prescription and over-the-counter drug products. But they are regulated, and they are regulated by the FDA, but the regulation that's in place, which is called the Dietary Supplement Health and Education Act, which was passed in 1994, unfortunately creates certain loopholes that can cause problems when it comes to product content and product safety and product purity. So if you think about a drug product, drugs, true drugs like over-the-counter drugs and prescription drugs are governed under the FDA Center for Drug Evaluation and Research. Supplement products are regulated under the Center for Food Safety and Applied Nutrition. So they're regulated under the same center that regulates food products. They're not regulated under the center that regulates drug products. Drug products, before they're marketed to you as a consumer, have to prove that they're both safe and efficacious. There has to be an abundance almost of literature to support that they're safe and efficacious before the FDA says, okay, you get the stamp of approval and now you can market your drug to the public. For dietary supplements, it's different because they don't have to prove that their product is safe to the FDA before they market it. They are responsible, however, the manufacturer is responsible for assuming the burden of safety. So that's where it's a little bit different. In terms of efficacy, they also don't have to submit proof of efficacy to the FDA before they market a product. They really don't even need to notify the FDA that they're marketing the product, other than the fact that after they market it, if the product has a structure function claim, they need to notify the FDA within 30 days that they've made a structure function claim. But overall, if they're marketing a product, they don't have to tell the FDA that they're marketing the product. And so the burden of efficacy, again, falls to the manufacturer, because the FDA does say that you cannot market something that has claims that are either false or misleading. So the claims that they make are meant to be truthful. They should be truthful. But the oversight of that can be somewhat difficult, because once it's on the market, the FDA can't take it off the market unless they can actually prove that the product is unsafe. There are only certain types of claims that dietary supplements can make. The ones that are actually FDA approved are health claims and nutrient content claims. So to give you an example of what a health claim is, it relates a food substance or a dietary ingredient to a health condition or a disease. An example here would be a diet low in sodium may decrease the risk of high blood pressure. Another one might be a diet high in folate can decrease the risk of neural tube defects. And these are all claims that the government has said, basically the manufacturer has submitted enough literature, scientific to support, so that the FDA says, yes, there is enough scientific support and we will okay that claim, and you can put that on your label. Some of the more recent ones where related to cancer, one that says a diet rich in selenium may decrease the risk of cancer, and that was getting batted back and forth because the FDA was saying, well, we don't have conclusive evidence, so we're not going to pass that health claim. So what they ended up doing was they ended up saying, okay, we'll let you put the claim on the label because there is data there, but after you state that selenium may be beneficial for reducing certain types of cancer, you also have to say a statement that says that the FDA has determined this evidence is limited and not conclusive. And so the FDA statement has to directly follow the health claim statement. So those are examples of health claims. And nutrient content claims, these typically appear on food products, and usually they are in relation to products that have an established percent daily value. So you might find a vitamin that says it's high potency, or you might find a food product that says it's low in saturated fat. So those types of descriptions, there are FDA qualifications for being able to put those on your product. There is a certain qualification for how much saturated fat is considered to be low in saturated fat. And there's a certain content of multivitamins that, content of the vitamins in the multivitamin that have to be present in order for you to determine that it's high potency. So those are FDA approved claims. Structure function claims, again, are not FDA approved, but you do have to notify the FDA within 30 days after the product has already been marketed of the claim that you have made. And that claim is then looked at by the Federal Trade Commission, who governs those. And again, most importantly, that the manufacturer is the one that's responsible for determining that the claim is not false or misleading, that there's no proof that has to actually be shown before that product reaches the market. It's really in the manufacturer's hands to substantiate that. And this sort of just lists some examples of types of structure function claims that exist. Importantly, when you look at structure function claims, they also have to be accompanied by this FDA disclaimer. And I'm sure many of you, in watching television or in reading ads in magazines, have come across nutraceutical products that either on television, it's usually in really, really tiny print at the very bottom of the screen, but also in ads it can be the same thing. But it has to be there. It doesn't have to be in bold print, but it does have to say that it hasn't been evaluated by the FDA and it's not intended to diagnose, treat, cure, or prevent any disease. When you think about disease claims and structure function claims, sometimes there's a bit of a gray zone where if you're a consumer, it's really hard to tell if a product is making a structure function claim or a disease claim. So I put together a little list here and I thought I would quiz you to see if you could recognize which ones were disease claims and which ones were structure function claims. So this first one, improves absent-mindedness. Now importantly, I also want to remind you the definition of structure function is that the supplement is intended to maintain normal, healthy structures and functions of the body. That's the definition of what a structure function claim is. So improves absent-mindedness. What does that sound like? Does that sound like a structure function claim or a disease claim? Okay, so it's mixed. I heard some people say disease. I heard some people say structure function. This actually does qualify as a structure function claim. The reason why is because absent-mindedness cannot be linked conclusively with a certain disease. It's not considered completely characteristic of a disease like Alzheimer's. Improves memory loss associated with aging. This is also structure function, and the reason why is because you're maintaining a normal, healthy process. The process is aging. Memory loss occurs with aging, so that's a normal process, and this is something that's intended to supplement that normal process. Improves senile dementia. This one's pretty obvious. That's a disease claim. Reduces cholesterol, disease claim. Maintains normal cholesterol. That's structure function because you're maintaining a normal healthy cholesterol. Relieves stress and frustration. That's pretty ambiguous, but it is a structure function claim. And relieves cramps and edema associated with menstruation. This one, you might, initially, your first inclination might be to say that this is a disease claim, but in actuality, the FDA has defined processes of menstruation and menopause as being normal, healthy processes. So it's actually okay to say this because this is a structure function claim because menstruation is a normal, healthy process. If you said something like prevents bone fragility in postmenopausal women, that would actually be a disease claim because preventing bone fragility implies that this is something that would be useful for osteoporosis. So again, it's a real fine line. It's not always so easy to tell. These are some other requirements of labeling for supplements. You have to state the name of the product. Importantly, there are certain products out there, specifically plant products, that have two names. They have the plant name, like chasteberry, and then they have the Latin genus and species name, which is Vitis agnus castus. So if you're not someone who's familiar with the Latin name, you may go out and be looking at products and you go, what is this Vitex agnus castus on the back of this? What is this? And, you know, unless you knew that this was chasteberry, you might not know what that is. So anytime you go out and you're looking to buy at least a plant-based dietary supplement, it's a really good idea to also know what the Latin genus and species name is for the product that you're looking for. And you can just see, I'm not going to read all these to you, but importantly, name and place of business and manufacture. That is important because obviously if there's some sort of problem with the product, you want to be able to contact the manufacturer. Products that are purchased solely over the internet, you know, may or may not have that on the container, and when you go to contact the manufacturer, the website may be gone. So I always advise people to purchase products, you know, from large chains or large nutraceutical distributors, preferably from a place you can actually walk into, versus a distant internet site that you may not be able to, you may not even know where that site is actually set up. The word dietary supplement has to be on the package. And finally, importantly also, cautionary statements are not required. So even if a manufacturer has had cases, let's say, of liver toxicity that maybe, I've had 2 cases of liver toxicity that have been reported to me as possibly being associated with my product, I'm not really required to put that on my label. So I don't have to state that. If I have a product that I know potentially lowers blood sugar, I don't have to state that it could interact with diabetes medications or that it could lower sugar in patients who have diabetes. So cautionary statements are also left at the discretion of the manufacturer, unless there's some FDA enforcement saying you have to put this cautionary statement on your product. There's also something called a supplement facts panel. Supplement facts panels are very similar to the facts panels you see on food products. They list your serving size, what's in your serving size, the amount in terms of weight, a percent daily value. This is usually from vitamins and minerals if a percent daily value actually exists. And also, if the blend is proprietary, the ingredients of that proprietary blend. So this is an example here of a supplement facts panel. This is actually a whole example of a dietary supplement. In this case, it's ginseng. It states that it's ginseng. Down here, it actually tells you that it's oriental ginseng. It's a powdered root, so it tells you the part of the plant. It says oriental ginseng, so this, if they were to use the plant name, it would be Panax ginseng. Tells you how much is in it, any other sort of ingredients or fillers, who the company and manufacturer is. The statement on this is, when you need to perform your best, take ginseng. And then the FDA disclaimer here. If this was a proprietary blend, and I know that everyone in this audience has seen proprietary blends, basically what they do is they will give you, it'll say 1 capsule contains 1,000 milligrams or whatever the total milligrams is in their proprietary blend. And then they'll say our product contains, maybe it contains Echinacea, ginseng, zinc, and another maybe a vitamin or something. So for a proprietary blend, the problem that I have as a pharmacist is that I actually don't know how many milligrams of Echinacea is in the 1,000 milligrams. I just know that Echinacea, you have to list it in order of the most prevalent to the least prevalent. So Echinacea is the most prevalent ingredient in the proprietary blend, but I don't know how many milligrams is actually in it, because you're only telling me it's 1,000 milligrams of this collective group of compounds. So when you look at clinical studies for ginseng or Echinacea, you realize that the pharmacologic effect is based on a certain dose or amount. So if you don't have a therapeutic amount of that plant or chemical, supplement in it, you're not going to see that effect from it. So that's the problem that I have with proprietary blends, is I feel like there's information that I would like to know that is not present. So overall, the take-home message here as a consumer is really that when it comes to purity and potency, it's the manufacturer's responsibility to assure that. Prior to 1997, there was actually no standards that the FDA had developed for supplement manufacturers to adhere to when it came to how they were going to manufacture their products, to make sure that they were pure and had what they had in it. In 2007, this new legislation was passed, which you can see for larger companies hasn't really even come into effect yet. Large companies have to comply by June 2008. Smaller companies have up until 2010 or 2009, depending on their size, to comply. But overall, the legislation that was passed, they called it the Good Manufacturing Practices Supplement Standards. And so this was their attempt at stating that we expect you as a supplement manufacturer to have certain standards in place that you're going to use to assure that what it says on the label is actually what's in the bottle. So that's new. I mean, it's at least a step in the right direction. How they're going to enforce this, I don't know. That's going to be difficult. But at least there, is a statement saying that this is what we expect of you. And if, obviously if they find that a company is not meeting that expectation, then they can, issue a product recall to that manufacturer for that product. I know this is a little bit blurry, but I just kind of wanted to give you an example of problems with product content. And this was published in the Los Angeles Times, and they basically took an independent testing lab and went out and tested 10 different manufacturers' brands of St. John's wort. And they tested them based on their labeled concentration of a chemical compound called hypericin, which at the time when this was done was considered the #1 constituent that you had to have in a St. John's wort product for efficacy for depression. Now we know that that's actually a different compound, but the point is that all of these products on their label said our product contains this amount of this chemical compound hypericin. And when the independent testing lab went and tested the product, and they tested 3 different products from each manufacturer. So this is a cumulative mean score here. But overall, 3 of these manufacturers, here, and here, had about 50% or less of the labeled amount. And interestingly, 2 of them had even more than what was anticipated. But the point is that there's a lot of variability here. Whether it's having too little or having too much, you really just want it to have just that amount. You would really like for this to be 100%, 100%, 100%, 100% in the ideal world. And there are tools out there to help you find those manufacturers who where product testing has been done and where they have indeed met their labeled claims related to content. And I'll get to that towards the end of my presentation. But this is just an illustration for you of illustrating problems with product content that has existed over time by leaving the content and the manufacturing processes at the discretion of the manufacturer. So the term standardization, you may have heard this term our product is standardized. I sell Ginkgo, and my product is standardized to contain 24% flavone glycosides. So what does that mean? What is standardization? And if a product isn't standardized, is that bad? Standardization really, truthfully, I've only seen it in relation to herbal products, which makes sense because when you're standardizing something, you're standardizing it to a chemical compound or a group of chemical compounds that are thought to contribute to the pharmacology or efficacy of the product. We don't really know for most plants what the chemical compounds are that make them efficacious because they haven't been that well researched. For the most commonly used plants, we do have information related to that, and so you will see standardized markers on products like Ginkgo and garlic. You may or may not see them on a product like Echinacea because it hasn't been conclusively shown that any particular grouping of chemicals at this concentration leads to efficacy in terms of treating a common cold. So standardization will only exist if the chemicals have been researched and if they've been found to be meaningful to the efficacy of the product. And I've listed some examples down below here. Now, importantly, if I went out and bought a melatonin product or a glucosamine product or a coenzyme Q10 product, those are not going to have a standardization to a certain chemical compound because it is only one chemical. It should all be 100% melatonin or 100% glucosamine sulfate or 100% coenzyme Q10. It's different from a plant which has numerous chemical compounds in it. And, trying to find a standardization then to the chemical group in that plant that is meaningful to the efficacy. And lastly, again, just pointing out again that the efficacy and safety is really also for the most part, in the hands of the manufacturer, because the claims cannot be false or misleading, but they don't have to submit proof that it actually does what it's stated to do. And the safety issue is left to the hands of the manufacturer as well. There is one exception to this, and it is if a manufacturer is marketing a product that contains what's called a new dietary ingredient. And so a new dietary ingredient is an ingredient that has never before been marketed prior to the passage of the Dietary Supplement Health and Education Act. So most plants and supplement compounds most of them have already reached the market. But if it was a new plant product that had never been marketed before, they would have to submit evidence of some safety to the FDA before the FDA would allow them to market that. The caveat here is that if I'm the manufacturer, how do I know if my product is a new dietary ingredient? Is there some master list of products and ingredients that were marketed prior to October of 1994? No. No, they don't, actually. Yeah, no, there's no master compendium of products, ingredients marketed prior to 1994. So it's really left up to the discretion of the supplement manufacturer, again, whether or not their product qualifies as having a new dietary ingredient. New legislation that also is really important to us as consumers is just the issue of safety. And I know that probably almost all of you did hear about the concerns over, when that whole thing with ephedra, when ephedra products were pulled from the market, and it had to do with the fact that they were causing stroke or heart problems in some patients or elevations in blood pressure. And it wasn't until the FDA received a number of these case reports, and enough of them, that they go, oh my gosh, like this is the same product and it's the same chemical ephedra that's involved with a number of these incidences. We better look into this. And when they did, they said, this is a hazard. This could really hurt people. And that's when they pulled it from the market. So the FDA can only pull something from the market if they can prove that it's unsafe. That's the only way that they can pull it. They have to prove it's unsafe. So the burden of proof is on them. In this case, that's how ephedra was removed from the market. Now, the manufacturer, prior to the passage of this, the end of 2007, had no obligation to report adverse events that were reported to them, even if they were serious, even if they were deaths. They did not have to tell the FDA that these were taking place. So as it turned out, and I think the company was Metabolife, if I'm not mistaken, that particular product had, when the FDA actually contacted them, had quite a few events that they had been keeping record of, but had just never forwarded those adverse event reports to the FDA. So now the FDA came up with new legislation, again designed to protect us a little bit more, which says that as a manufacturer, if you have an adverse event that falls under the category of serious, you have to report it to the FDA. And by definition of serious, just got to pull it out here. Serious is defined as death, life-threatening experience, hospital admission, disability, birth defect, or medical or surgical intervention required. So there's a very strict definition that applies to that. If I get other case reports of a lot of people just having migraine headaches with my product, I don't actually have to report those unless it requires them to go see a doctor for it, in which case it would, if it was related to a hospital admission, I would have to report it. And they also have to maintain now their records for 6 years, so there's a requirement now for maintenance of adverse effect reporting. All right, so I'm going to move forward and just talk a little bit, these are sort of obvious things. Why are patients using these products? Well, certainly, in California, we're a very healthy state for the most part, I think. There's other states that actually rank above us in terms of health and preventative medicine, but we're still pretty healthy. Mostly we have good weather, we get out there, we try to exercise, we try to do things that, eat right, take vitamins or minerals, if we know that our diet isn't the best. And so overall, we're trying to maintain kind of a well-balanced, healthy lifestyle. And so being an active participant in that, if you felt that a supplement would contribute to that, is one of the reasons people take these products. There also is, various folks who just don't, they've lost faith in the Western medicine system. They really prefer using more alternative practices or alternative medicine. Or they don't like the attitude of Western practitioners towards alternative medicine. And there's just a list here, a lot of different, natural implies safe and healthy is also another one that is common. The example I always use is, poison oak is natural, but you don't want to eat it. So not everything that's natural is safe and healthy. This is actually a survey where it was published in the Archives of Internal Medicine, and it looked at what were the attitudes or thoughts of people who used dietary supplements as compared to people who did not use dietary supplements. And the primary rationale for use was to improve overall health and well-being. A subset, about 36%, thought it would help them to live longer. Users were more likely to believe that the product was beneficial for a broad array of medical conditions, and most of them would consider using a supplement if they were terminally ill. Users would continue to use these products, 71% would, even if the FDA said it wasn't effective for that indication, that they would continue to use it irregardless of the FDA stating that it doesn't work for that. About 50% felt that their healthcare provider was prejudiced against their using dietary supplements, and 44% said they felt their doctor knew little to nothing about dietary supplements. So this is a problem, obviously, because really important as a pharmacist, as a nurse, as a healthcare provider to know and be able to screen for interactions with not only other medications but also with conditions that you may have. So it is important to disclose that information. The largest survey we have, unfortunately, is about 6 years old. It's the 2002 National Health Interview Survey. They surveyed about 30,000 Americans, and they asked them specifically regarding their use of non-vitamin, non-mineral supplements. And the reason that that's important is because when you look overall at the class of supplements, the number one selling products are vitamins and minerals. And then it goes to the next product that's not a vitamin or mineral, I believe, is glucosamine, that has the highest sales based on, I think, 2006 statistics. But here, you can see that about 1 in 5 reported using a non-vitamin, non-mineral supplement, and that users were more likely to be women in their peri- and postmenopausal years, college-educated, living on the West Coast. That almost defines me, just a little shy of 45, but it, interesting statistics. A majority of patients, or people who took this survey, I shouldn't say patients, a majority of adults didn't tell their healthcare provider, and those folks also were taking prescription drugs at the same time, so that's a concerning statistic. And this is just a listing here of the types of conditions that were most commonly being treated, with the most prevalent being cold and flu type symptoms. This is a summary of the top selling products. From this list today, we're going to talk about Echinacea, Ginseng, Ginkgo, Glucosamine, St. John's wort, and fish oil. And now I'm just going to switch back a little bit and talk about other hazards that can occur with dietary supplement products. And one of them has to do with unintentional, in many cases, plant substitution. This can happen, let's say, if you're someone who goes out. I'm sure you've seen in the news case reports of people who went out to harvest mushrooms, and they accidentally didn't pick the right ones, and they got the amanita mushrooms and ended up with liver toxicity because the whole family had mushroom soup for dinner or something like that. So that's an example of mistaken identity. So it can happen when you're out there harvesting your own herbs to brew as a tea. There's cases of, digitalis poisoning. That's a cardiac type medication that's actually used in people who harvested foxglove instead of the herb that they thought they were getting. And there's also case reports by manufacturers who've accidentally, put plants into their product that they thought was Echinacea, but it turned out to be a totally different plant that looked like Echinacea. So it's important to know what's in your product. Adulteration or contamination can occur either intentionally or unintentionally. Sometimes in the manufacturing process, depending on how the product is manufactured, some of the heavy metals used, to either grind up the herb or grind up the supplement can end up in the product itself. So here's an example of, this was a survey done, published in the New England Journal of Medicine, where they looked at 260 Asian patent medications from California retail herbal stores and found that 32% had undeclared pharmaceuticals or heavy metals in them. So that was concerning. This gives you an example. This is a little bit more recent. This release just came out. I think this was like in the past year. There's always products that are being recalled constantly. You can go to the FDA's website, www.fda.gov, look under the link for dietary supplements, and you can actually find products that have been recalled, products that have contained contaminants, products that are being given warnings or citations for making claims that are either disease claims or just misleading or false claims. So this is a product, this came out of a manufacturing plant in Florida, and it said, and it was for male enhancement. See a lot of those on the television now. And it said, the legendary super pill is no longer a myth, infinitely more effective than other sexual enhancement products. And it turned out that this product contained compounds that were Viagra-like, so basically sort of prescription drug-like compounds that were derivatives of Viagra. So this product was then the FDA said, you need to remove this product from the market. Another product that the FDA asked to be removed from the market, this manufacturer was in California, and they were marketing a product called Zenchi for persons who had high blood sugar. And this product contained prescription glyburide and fenformin, which are prescription drugs that are used to treat diabetes. This was a mail order product. It can only be purchased by telephone or over the internet. But on the website, when it was up, it said the product had no side effects, no toxic, FDA approved, and 97% effective. So, big warnings here. FDA approved, not FDA approved if you're saying that it lowers sugar, because that's a disease claim. No side effects. If you're taking a supplement for an efficacious purpose, it makes sense pharmacologically that if you take too much of it, it can also have a side effect. So, and then 97% effective, that would potentially make it more effective than prescription drugs that are out on the market. So if it sounds too good to be true, always beware. The other thing that I always find interesting about this, it's not really even grammatically correct, so I don't know how much faith I would put in that statement. And finally, direct toxicities. Direct toxicities, again, happen based on the pharmacology of the product, and it's just an extension going from here's what it does for efficacy, and if we go over that line, now we're into the toxicity area. And you may or may not have seen, there was a case actually very, very recently of this gentleman. I don't know where he lived, but they called him the Smurf Man. And it was I swear, it was like 3 months ago on Good Morning America. He was in there with Matt Lauer and getting interviewed, and Nancy Snyderman came in and gave her information on colloidal silver. But overall, unfortunately, certain side effects are not reversible. With many drugs and many supplements, they are. You're having stomach upset, you stop taking the product, the stomach upset goes away. You had an elevation in your liver enzymes, you stop taking the product, the side effects go away. In this case, unfortunately, with colloidal silver, if you use too much of it, it can contribute to this discoloration of your skin, which makes your skin appear kind of bluish gray, and that's permanent. That doesn't go away, even when you stop using the product. Other cases, direct toxicity, there's some rare cases that have been reported for black cohosh and green tea extract. This green tea extract is different from green tea that you drink as a tea, so don't freak out because I drink green tea too. and really enjoy it, and it has a lot of health benefits. But this green tea extract is a very defined, concentrated, alcoholic extract of green tea, mainly in products that were being used for weight loss. And it was about 14 cases that were reported, whereas for the black cohosh, it was about 40 cases that were reported. But given how widely used black cohosh is, it's very difficult. If you don't do product analysis, it's very difficult to contribute an effect to the actual supplement. And it's very hard to know if it's even causing that, because in randomized controlled trials, it hasn't shown to affect liver enzymes over the course of 3 months of use. The last hazards that I'm going to talk about are hazards related to interactions. And how do we know if something interacts? Well, in some cases we do, because we have literature to support that. The number one herb, actually the number one interaction offender, bar none, with supplements is St. John's wort. And it affects a group of enzymes in the liver that metabolize a lot of different medications. It also affects a drug transport protein that affects drug concentrations of digoxin. So overall, this particular herb can reduce the efficacy of other medications. Not all medications, some medications. There's cases of reduced efficacy of birth control pills resulting in unwanted pregnancy, case reports of reducing serum levels of cyclosporin resulting in a graft rejection in someone who had had a transplant, lower levels of an antiretroviral called indinavir, and digoxin, and there's a list. It goes on from here. But there's a lot of different drugs that it can affect. And the message that I tend to give when it comes to St. John's wort, because it is a really good herb when it comes to mild to moderate depression, the message that I give is don't take it. First of all, don't take it unless you've had your depression diagnosed by a physician, first of all, and you're in agreement as to the severity of it. But also just don't take it if you're taking medications that are really essential to your health. So if I'm someone who's taking drugs for cancer or HIV or those types of conditions where these drugs are really essential to making sure that I stay healthy, I probably wouldn't want to take St. John's wort because of the risk of drug interactions. There are cases of herbs and supplements that have additive or opposing effects. So that all that means is that the pharmacology of the product is similar to, let's say, a prescription drug that you're taking. So if I take St. John's wort and I take Paxil for my depression, there are case reports of reactions of when the levels of serotonin in the body go too high. There's case reports of, one case report of someone who took kava kava with Xanax and had sort of a lethargic, semi-comatose kind of reaction to that. So when you have herbs or supplements that have pharmacology that's similar to prescription drug pharmacology, they can be additive. And they can also be opposing. So theoretically, there's no case reports of this yet, but theoretically it's advised that if you're someone who takes Echinacea and you have an autoimmune disorder, let's say you have lupus or you have rheumatoid arthritis, not to take Echinacea in combination because it could affect your disease. Or if I'm someone who's taking immune suppressants, taking something that's an immune enhancer may not be the wisest decision. Again, when we get to the end of this talk, I'm going to give you the resources, drug information resources, to help you research these types of questions. So when they come up, you can have something to go to, because there's so many different questions that can arise. And finally, just hazards introduced by the consumer. These are either individuals who choose to use alternative dietary supplement treatments in lieu of standard medical treatments that may have more proof of efficacy for a condition, or it may be someone who either intentionally or accidentally over-supplements. One of the most common things that I see, I work in an anticoagulation Coumadin clinic a half day a week, and when I get patients who come in with their prescription bottles or with their supplement bottles, and there's like 5 different supplement bottles and they all have vitamin A, 100% of the daily value, but collectively now they've got 500% of the daily value, but they don't think about that because they all have different names or they're using them for different reasons. So you need to actually look at what's in the products that you're taking and go, if this has got 100% and this has got 100% and this has got 100% and that's all the same thing, Am I over supplementing? And is there a problem with that? Is it something where the body will just naturally eliminate that from your body if you are over supplementing, or is it something where you could have possible side effects? In terms of the products today, we're going to talk about Ginkgo biloba first. This is one of the oldest living trees in the world. It's highly resistant to pollution, so it's found in many different cities. Historically, the Ginkgo biloba fossils actually date back about 200 million years. That's how old it is. So it truly is one of the oldest living trees on the face of the planet. And the supplement form is prepared from the leaves of the plant. There are some standardized markers to which this is standardized, and I've listed them here for you. So when you go and if you're purchasing a product like this, you know what to look for on the label. If I was going out and buying this product for myself, I would be looking for these things that I've listed here. I would be looking for the content of flavone glycosides as 24%, terpene lactones as 6%, and I would be looking for an extract ratio that falls somewhere between 50 to 1. So that means that 50 parts of the leaf are used to prepare 1 part of the extract. So those are just things that you should look for on the package labeling. These are some of the things that it's been studied for, and by far the most commonly studied indication is for cognitive insufficiency or dementia. The other leader here in terms of clinical trial support is for peripheral arterial occlusive disease, or poor circulation or blood flow to the legs, and actually improving pain-free walking distance. And I'm not going to show you those trials today for pain-free walking distance, but we will talk about the trials for dementia. Everything that I've listed under the other category here are things that have, there may be 1 trial, there may be 2 trials, but overall it's really inconclusive. And for the stuff that's inconclusive, in general, I don't recommend going out and using it for these things. I guess if it's not going to hurt you, you could try it, but overall, just letting you know that there's not a lot of clinical support at this time for everything listed under the other category. When you look at what is involved with Alzheimer's disease, there are certain things taking place in the pathophysiology. So you have higher levels of oxidation, you have low levels of a neurotransmitter called acetylcholine, you have a presence of amyloid beta fibrils, which form plaques in the brain that cause neuron degeneration. And when you look at Ginkgo's mechanism, you can see how it could be beneficial for this. You can see that it has blood thinning effects, antiplatelet effects. It's an antioxidant. It helps to dilate blood vessels. And at least in the test tube or in vitro, it's been shown to enhance levels of or decrease amyloid beta fibril aggregation, and in animal models to increase levels of acetylcholine. In terms of clinical support, I tend to look at systematic reviews and meta-analysis because this is a real easy way to pull together the bulk of the information that's been published. And usually if it's something like what's called a Cochrane review, the Cochrane review does very evidence-based reviews. They tend to look at only randomized trials or very specific criteria for what they include. So in this case, this was a review looking at Ginkgo for dementia or cognitive impairment, and they included 33 randomized, double-blind, placebo-controlled trials, the longest of which was a year in length. And what they observed was, overall, they found significant, small but significant improvements in both cognition, activities of daily living, and even with some doses for the clinician's assessment of global improvement. Overall, however, when you look at how strong of an effect we're seeing, and you compare it to other Cochrane reviews of a drug class called cholinesterase inhibitors. So these are drugs like Aricept, which is donazepam, Exelon, which is rivastigmine, and Razidine, which is galantamine. These are prescription drugs that are all pretty much the leaders in treating Alzheimer's disease. They're sort of the first-line treatment options. And when you compare the level of improvement in cognition seen with Ginkgo as compared to these other drug compounds, that the level of improvement is still smaller. So just putting it in perspective in terms of there is an effect, but it's certainly not as big as what you're going to see with a prescription drug. So the guided and GEM studies, this is sort of the direction, what's on the horizon. You want to know what you're going to hear about in 2010? You're going to hear about the results of these trials. And these are trials looking at, can using Ginkgo biloba prevent or delay the onset of Alzheimer's disease in individuals who are coming to the doctor and presenting for the first time with some, complaints of cognitive function problems. And very large sample size, up to 5,000 patients over the age of 70. They're using a standardized Ginkgo biloba extract that's been used in other clinical trials, so that's good. They're using a dose that's been substantiated based on the Cochrane review, which is good. And they have good study design, randomized, double-blind, placebo-controlled study design. So I'll be really interested to see what these results show. Efficacy in healthy persons. So the bad news is that it really doesn't look like it does anything for people who are healthy and who don't have any sort of, what's the word I'm looking for? Any sort of, I want to say predilection, but I don't even know if that's quite the right, I don't even know if that is a word. Predication, maybe that's what towards Alzheimer's disease or cognitive impairment. So these were all done in healthy adults. There were some studies in healthy seniors that showed improvement in maybe 1 or 2 memory tests, but they were looking at like 10 memory tests, and they go, oh, well, here's 10 memory tests, but they did show an improvement in this one, so there must be an effect. So that's sort of selectively picking out results and trying to highlight the benefit. In this case, there were things related to long-term memory storage, and that test was involving having them remember a series of names, and also retrieval and delayed recognition and recall, which basically means I would say to you something like bread, pencil, rabbit, fish, and then 10 minutes later I'd say, well, what were the 4 words that I said earlier? So that's the kind of delayed recognition recall we're talking about. In healthy young adults, same thing, no consistent effect. Really no consistent effect with either of these groups. So I do not recommend it for healthy individuals who don't have some sort of cognitive impairment. In terms of side effects, it's a relatively safe herb to use. It does not have a whole lot of side effects. Because it can have antiplatelet effects, you don't want to use it in combination with things like warfarin, which is a blood thinner, or with other antiplatelet drugs, because there have been a few case reports of bleeding side effects. You also want to be careful. Anytime you have an herb or a supplement that has antiplatelet effects, you want to discontinue using it about a week before if you have a surgery that's coming up. I also said avoid using in patients with a history of a seizure disorder. This really has to do with some case reports of seizures that were reported, but the reality is that it's really the ginkgo nut and not the ginkgo leaf that has a neurotoxin in it that's been linked to seizures. And you might go, oh my gosh, ginkgo nuts linked to seizures, the ginkgo, the neurotoxin in ginkgo nuts. Well, it's really uncooked ginkgo nuts, because cooked ginkgo nuts are really kind of a delicacy in China, and they're eaten all the time quite safely. So it's uncooked ginkgo nuts do have a neurotoxin that has caused case reports of seizures, and it's thought that maybe in these reports involving ginkgo leaf preparation, it might have been a contaminant that was present. And there is one case of a sedative reaction in someone who combined ginkgo with a sedative medication called trazodone, but pharmacologically ginkgo doesn't have sedative effects, so this one I don't put a lot of weight into it, just because pharmacologically it doesn't add up, and then no product analysis was done, so it's real hard to say for sure if it was the ginkgo that was the cause. This is a summary slide. I put it in here mainly for you just to have information regarding how much you should take, if there's an equivalent to the products, the European products that have been studied in clinical trials, and in general, how much literature do we have in terms of length of effect. And the longest trial that was done with ginkgo was a year, so we don't know how efficacious it would be beyond that. The next product I'm going to talk about is St. John's wort. This is something where the above ground parts of the plant are used for mild to moderate depression. Again, anything listed under other is something that should not be seriously entertained for clinical uses because it has not, doesn't have enough clinical support at this time. Products do carry a standardization, and in this case, they might say they're standardized to 0.3% hypericin or 5% hyperforin. It's really the hyperforin, though, that seems to be the most important chemical compound, because hyperforin by itself, in addition to the extract in its entirety, increases serum levels of norepinephrine, dopamine, and serotonin. 5-HT means serotonin. And overall, when you look at the Cochrane information or meta-analysis, what we see is that this was a meta-analysis done in 2005 that had 26 trials which compared St. John's wort to placebo and showed that it was more efficacious than placebo. 14 trials comparing St. John's wort to either a tricyclic antidepressant, which is sort of the older group. That's what I was taught when I was in pharmacy school. And then you had all the newer ones, which are called the SSRIs, which are your Paxils and your Prozacs and citalopram and those kinds of drugs. 7 comparisons to St. John's wort with SSRIs, 7 comparisons with tricyclics, all showing equivalent efficacy. So some pretty good support here for St. John's wort for mild to moderate depression. Caveat is most of the comparative trials did not have a placebo arm. So really the gold standard, what you want to see is you want to see the herb, you want to see the drug, and you want to see a placebo arm, so we know how much of this is a placebo response. Only three trials actually to date that have been published have had that. So that's one caveat. And the other caveat is that the longest clinical trial to date was only 12 weeks. So we don't have any information in terms of long-term efficacy data. Side effect-wise, again, we mentioned the drug interactions that occur with this particular herb, not to use it for pharmacologic reasons in combination with antidepressants, at least not without the supervision of your doctor, because there are also case reports of something called serotonin syndrome, which was having a high level of serotonin in the bloodstream causing adverse effects. There have been some case reports of sort of a mood enhancement or mania, agitation, hypomania, and finally photosensitivity, which typically occurs at doses that are 2 to 4 times the recommended dose. And interestingly, were initially observed in animals that were grazing on St. John's wort, and they noticed that these cows and sheep were getting sunburned. So for St. John's wort, it is a good idea to wear, sun protection, eye protection when you're using it. And again, here's a summary slide just giving you information about dosing, standardization, and also U.S. equivalents of European products. And now I'm going to flip over to ginseng. This is actually a picture of American ginseng. American ginseng is also called Panax quinquefolius. It's actually the root of the plant that we're most interested in this case, not the leaves. And you can see that there's a bunch of different types of ginseng that's marketed. The ones that you're most likely to come in contact with as you go into a pharmacy or into a nutraceutical distributor like GNC or something like that are the top 2. Chinese or Korean ginseng and American ginseng. And the others aren't really as prevalent. Also, the top 2 are the ones that have been most commonly studied. So it is the root of the plant that is used. The actual word for Panax ginseng comes from the Greek word panacea, which is for cure-all, and the Chinese word zhenshen, I don't know if I'm pronouncing that right, which means likeness of man. So what this really abstracts to is a cure-all for man. And that's kind of how it's used. It's an adaptogen, or it's touted as an adaptogen. Now, some problems with the ginseng industry have cropped up over time. One of the problems is that it really takes about 4 to 5 years for a good ginseng root to mature to the point where it has enough ginsenosides in it, but also that it's reached a reproductive capacity so that it can make other ginseng plants before it's pulled. That's important because if you don't wait long enough, you're going to have, you're not going to have enough ginsenosides in your product. The other problem is that because it takes so long to mature, there have been some problems with over-harvesting. And in 2003, the World Health Organization listed Panax ginseng as an endangered species due to over-harvesting. So in some cultures, the wild variety is preferred to something that's cultivated. It's thought to be more potent or more efficacious. And so because of that, there is this concern about wild ginseng and endangerment of wild ginseng. Also, it has led to some problems with cost and also content with ginseng products. There was this one analysis done a while ago, but it was done by the Philadelphia College of Pharmacy and Science, and they looked at 54 ginseng products, and 25% had no ginseng, 60% had subtherapeutic amounts. So again, this goes to the problems that we've seen in the past with content, being assured of the content based on what's on the label. Hopefully these new standards that are coming forth are going to help or encourage at least manufacturers to meet their labeling claims. But again, I'm going to give you a resource that's going to help you to know where to look for manufacturers that do meet those labeling content claims. In terms of standardization, it's the ginsenosides that the product is standardized to, 4 to 7%. And pharmacologically, there are a lot of different things that have been observed, but there are 32 different ginsenosides, in a root product. So a lot of these pharmacologic tests have involved one or more of these ginsenosides being pulled out and analyzed, and then the effect has been reported. So collectively, it's very difficult to say collectively that these are all the effects that you would see if you used ginseng. In terms of how it's used clinically, the ones where I've put double stars, so you can see here cold preventative, anti-cancer, lowering postprandial, which means after eating sugar in persons with diabetes, those are really the three that have the best clinical support. The other three, the adaptogenic claims, the improvement in mood and cognition, the enhancement of physical performance, really have not met with success, I would say, in clinical trials. It just hasn't been, those claims cannot be upheld by the literature that's been published in those areas. So the direction that we're looking in now is, ginseng as an immune enhancer, almost like Echinacea, its efficacy in cancer and its efficacy in terms of, could it be something that would be beneficial for persons with diabetes. And the clinical trials that I'm going to show you really relate to immune enhancement. And this was a study here that was a study done in 227 patients. It was a randomized, double-blind, placebo-controlled trial. And they used a standardized Panax ginseng product called Ginsana, which is available in almost any grocery store. So Ginsana or placebo in combination with a flu shot. And what they found was that at 12 weeks, there were far fewer cases of flu that were reported in the people who had been taking Ginsana with their flu shot as opposed to people who were taking placebo and Ginsana. Well, this study was published in 1996, and little had been published since. But recently, there's been this interest now in Ginkgo for its immune-enhancing properties. And you can kind of see this growth in publications, 2004, 2005, 2006, where we have three new clinical trials that also support this role. Two of these trials were, again, in this case, they were using a different species of ginseng, the American ginseng, not the Panax ginseng that I reported in the last trial. So these were using an American ginseng extract for 4 months in combination with the flu shot as compared to placebo and the flu shot. And in senior citizens, 2 of these trials reported significant reductions in cold frequency, and one of the 2 also found a reduction in cold duration. In healthy adults, it didn't have as robust an effect. And this other study here was not done in conjunction with flu shots. So basically, it was just giving American ginseng or placebo for 4 months and looking at the incidence of colds in people who tended to have frequent colds. And they didn't find any difference in the number of people who developed one cold over the course of 4 months, but they did find a significant reduction in those who developed 2 or more colds at 4 months, that there were fewer colds lesser severity in people who developed 2 or more colds over 4 months in the ginseng group. So overall, some pretty good preliminary evidence here saying that ginseng might have a nice little anti-cold type effect. Side effects from ginseng. We know that ginseng has a chemical group in the plant called methylxanthines. Methylxanthines are also structurally related to caffeine, and this could be why there are some case reports of agitation and excitation, sort of a stimulatory type response that's been observed with ginseng. There's also case reports of people who have had prior bipolar and schizophrenia who've taken ginseng and then had problems with that excitability, manic type behavior. There are some case reports of hormonal type side effects, breakthrough vaginal bleeding, breast tenderness, breast pain, and finally, the effects that I mentioned on blood sugar. So to be careful if you're someone who's using this and have a history of diabetes, that it could lower your sugars. In terms of drug-drug interactions, it also has antiplatelet effects, similar to Ginkgo. So we don't want to use it in combination with Coumadin or other blood thinners. And then because it may have an immune-enhancing effect, kind of like Echinacea, now we have to consider the same theoretical contraindications, which would be don't use it if you have an autoimmune disorder or if you're taking immune suppressants. And overall, this is the dosing that's been used in clinical trials. The Ginseng is a very popular product of the Chinese varietal. Dosing is 200 to 400 milligrams a day of that, or the crude root, which is 2 grams a day. Echinacea is the next product I'm going to talk about. There is a variety of different plant species out there. The one that you should be most familiar with is the Echinacea purpurea, the above ground parts, because this is the one that's been shown to have evidence of efficacy in cold treatment trials. Overall, in terms of cold treatment trials, this was a meta-analysis that was done. They basically included only trials that used Echinacea as a single ingredient and only used it for natural development of colds, not for trials that inoculated people with a virus to make the cold happen. And they found a total of 16 trials. And overall, for prevention, they didn't find a benefit. 3 of the trials didn't show a benefit for prevention, but of the 16 treatment trials, a majority showed a benefit. And those that did show a benefit most commonly involved the above ground parts of Echinacea purpurea in this fresh pressed juice formulation. So that was the most efficacious product. So overall, what they concluded is that there's some evidence of efficacy for the above ground parts of Echinacea purpurea in the early treatment of colds, and for prevention, it's not supported right now by the literature, and species other than Echinacea purpurea is also not supported at this time, and use in children is not supported at this time. Side effect-wise, the worst side effect is bad taste. If you can tolerate the taste and the frequency of the dosing, you're A-okay. There is a slightly higher incidence of rash in children, so that is something where you'd want to be careful. And this I've just included again as a dosing slide so you know how it's dosed and the product that was used, and contraindications again for people who have a history of immune disorders. The question was, how did it work? What did it actually do? And it did both. It actually did decrease symptoms, and it also decreased the duration, the cold duration. And if this is something that you are interested in, I want to point out that there is another meta-analysis that I didn't include here. It was published in The Lancet in July of 2007, which reported a 58% reduction of developing a cold and a reduction in duration of 1.25 days using Echinacea products. But they included all different products. They included inoculation trials as well as natural cold development trials. Glucosamine is an amino sugar. It's naturally found in our cartilage cells. It's something that's used as a building block for something called proteoglycans, which are present in our cells. It comes as a variety of formulations, 3 different salt formulations. Glucosamine sulfate is the one that's been studied the most and really has sort of the evidence to support it. These products typically are made from extractions of chitin. So chitin is something that comes from shellfish. You don't have to be worried if you have a seafood allergy because it's actually the meat of the shellfish that causes the allergic reaction, not the exoskeleton or chitin. The cartilage, it protects our bones. It provides the cushioning. It's made up of these different chemical groups: cartilage cells, protein, water, proteoglycans. And it's really the proteoglycans where glucosamine is used as a building block. Osteoarthritis, you basically have a breakdown of the cartilage taking place, trauma to the bone, inflammation, and pain that occurs because of that. In terms of how glucosamine works, it does have antioxidant effects, anti-inflammatory effects. It does increase the production of proteoglycan synthesis and decreases the activity of enzymes that would otherwise damage structural proteins. It's also been shown that the sulfur group specific to glucosamine sulfate may be important for this bone mineralization process, which may be why glucosamine sulfate is a preferred formulation. Notice, however, that all of these are in vitro, which means these are occurred in the test tube. We can't substantiate these effects in humans. In terms of efficacy, the Cochrane review says summatively that it works if you're using glucosamine sulfate for improving pain and improving function. Comparisons to nonsteroidals, which are things like ibuprofen, there was 2 trials that showed that glucosamine was superior in pain relief than the nonsteroidals, and 2 that showed that it was equivalent in efficacy. And there's also a couple of trials that were 3 years in length that showed a slowing of progression of osteoarthritis. There's a publication that came out recently as a follow-up to this trial where they not only looked at 3 years, but they extended it out for people who wish to continue up to 7 years and showed a decrease in hip replacement as well in the group that was using the glucosamine. So overall, this looks pretty good. Some caveats are that there's a few caveats that go along with this. The product that was most commonly studied was a product not available in the United States of glucosamine sulfate, and about 65% of these trials involve that one brand. And if you actually took that brand out of the analysis, it didn't have an effect on pain or functional scores. So there was a question of, well, is it something related to this particular product, or not real sure. The largest trial to date was this GATE trial. The interesting thing was that it had 5 different arms. So it had a glucosamine arm, a chondroitin arm, a combination glucosamine-chondroitin arm, a prescription drug arm for Celebrex, and a placebo arm. And it was for knee osteoarthritis, and they were looking at 6 months who had achieved a 20% reduction in knee pain. And in this study, it was only the Celebrex arm that showed a significant improvement as compared to placebo. But the interesting thing here is you can see that the response rate in the placebo group is quite large, much larger than observed in most trials of knee osteoarthritis. Usually it's around 30%. So this is very large. And so, even the Celebrex had a hard time being superior to a 60% placebo response rate. They did find when they looked at patients who had moderate to severe pain specifically that the combination was actually statistically significantly superior to placebo. So overall, glucosamine, certainly in my opinion, worth a trial if you've got osteoarthritis. If I were to recommend it, I would recommend the glucosamine sulfate product. I say go ahead and try it as a 3-month trial. See if you notice a difference. If you're not noticing a benefit, stop using it. If you are noticing a benefit, great. Continue using it. The dosing is listed here for you. It's typically given as a once daily dose, 1,500 milligrams. And initially, where there was some concern that because it has a sugar as part of its structure, that it might be bad for diabetics, that's pretty much been dispelled. It's actually been studied in diabetics and not shown to have an effect significantly on glucose levels. The last herb I'm going to talk about is fish oil. And by far, I also label this particular supplement as the jack of all trades, because it has so many areas where I swear to you, I could like run on for a day about the benefits of fish, eating more fish and fish oil products, because they've shown benefits in so many different areas. Overall, in the United States, we don't consume enough. You can see here the ratio of omega-6. Now, omega-6 fatty acids, these are all essential fatty acids, so the body doesn't make these. We have to get these from an outside source. And omega-6 fatty acids, we can tend to consume more of those than omega-3 fatty acids, which are like the fish products. You can see the ratio of our consumption compared to, Greenland Eskimos. That's the mainstay of their diet is fish, so they have a 1-to-1 ratio. But we've also observed in epidemiologic trials that there's a higher risk of cardiovascular disease, a higher risk of depressive disorders, a higher risk of inflammatory disorders when you have this higher ratio of omega-6 to omega-3 dietary intake, or in populations that consume more fish, they have a decreased level of these types of disorders. In terms of the sources, one of the questions I'm often asked is, what's the best source? The best source is dietary fish. That really is the best source. If you can eat 2 to 3 servings of fish a week, that's fantastic. I'm not a big user of pills. I don't often recommend pills. If you're a woman who's pregnant and you want to use it, the pill formulation limits the mercury exposure. There's negligible amounts of mercury in omega-3 fatty acid fish oil supplements. So that's a healthy way to go for that. The reason why we're using them is because we want to enhance our levels of these two compounds, DHA and EPA. Overall, there's other sources for omega-3 fatty acids. You may have heard of flaxseed or flaxseed oil, very popular. It contains a precursor called alpha-linoleic acid. This is a precursor which eventually goes on to form EPA. The problem is that it's not real efficient in doing that. Less than 5 to 10% of ALA ends up getting converted into EPA, and 2 to 5% is converted into DHA. So you have to consume a lot more. The other thing that's interesting is that there are epidemiologic trials showing that supplementation, actually not supplementation, but rather a higher intake, a higher level of alpha-linoleic acid has been associated with, and it's not for sure. These are epidemiologic trials, so it's not like this equals that. There's some literature out there which suggests that there may be an association, that's what I'm trying to get at, between higher levels of alpha-linoleic acid and prostate cancer, and also higher levels of alpha-linoleic acid and macular degeneration. So the recommendation right now is to not use ALA oils in men who have a history of prostate disease, but rather to recommend fish and fish oil supplements, which have both been shown to cause reductions in macular degeneration and in prostate cancer. So the fish and the fish oil is the way you want to go, at least for those two conditions. Overall, the benefits are very broad. So we know that it reduces triglycerides. There's actually an FDA-approved fish oil product called Omacor that's been approved for reducing very high triglyceride levels. It's cardioprotective. It reduces the incidence of heart attack, even if you've never had a first heart attack. If you have had a first heart attack, it decreases the incidence of having a second heart attack. So the American Heart Association has also put their stamp of approval on recommending that people increase their intake of fish and fish products. Depression. It has some benefits in clinical trials as an add-on therapy for depression. There's about 17 trials looking at it as a treatment for rheumatoid arthritis, which have shown improvements in pain relief. In pregnancy, it's been shown to have benefits in terms of increasing the length of gestation, increasing birth weight in babies, having better visual acuity in children, and also most recently, and this is a study that just came out in Lancet 2007, that when they followed this is something that came out of the UK, but when they followed the children of women who had consumed fish products versus women who didn't consume any, that there was better communication skills, better fine motor skills, better pro-social behavior in those children of those women who were using fish products, or fish in general in their diet. Side effect-wise, it doesn't have a whole lot of side effects, may cause some GI disturbance. It does have antiplatelet effects, so this is another product that we want to be careful if you're someone who uses Coumadin or blood thinners. Also, the dosing depends on what you're trying to remedy. If you're taking it for triglyceride reduction, the dosing is much higher than if you're trying to use it to prevent, heart disease because you're at a higher risk for heart disease. So the dosing here is very specific to different areas, and you should just take a look at that if you're someone who wishes to use fish or fish oil products. I do want to say that, just to put it in perspective, if you were to eat a 3 to 4 ounce serving of herring or salmon, the amount of EPA and DHA that you would get is about 1.6 grams in that serving. And that if you were going to eat something like tuna or cod or catfish, in a 3 to 4 ounce serving would only have 200 to 300 milligrams of those EPA and DHA. Question? Great question. Is this farmed or wild? It's a very good question. The amounts are different depending on if it's farmed or wild. So you will have different amounts of omega-3 fatty acids. Usually it's higher in wild than it is in farmed. Higher amounts of those omega-3 fatty acids. But in order, in general, what I recommend, there are certain websites that will kind of lay it out for you. These are the fishes, these are the amounts of EPA and DHA that they have per 3 to 4 ounce serving. And I can share that with you after the talk if you're interested in that. Okay, so let's move on to the last pieces, which shouldn't take more than about 5 minutes. And they have to do with general recommendations and how to search for information if you're asked a question, or if you want to know, you got a family member who wants to take this. First thing is, I always say purchase it from a big distributor. Why? Because the big distributors have more to lose if there's a problem. Make sure that the product has the common things you'd see on a normal bottle: a lot number, an expiration date, the manufacturer's name and address. I say avoid products with a long list of ingredients, but the reason I say that, it's not a absolute. It really is more that, again, goes back to this whole idea of the proprietary blend, and not really knowing if there's if it's a proprietary blend, how much of each individual ingredient is in that. Here's where in terms of resources that are available to you, Consumer Lab is probably one of my #1 picks for consumers. If you're interested in getting information about, there are 3 different labs, if you will, that do testing on these products. Consumer Lab goes out and just tests products. Manufacturer doesn't ask them to test their product. They just go out and test products. They go, this month we're going to test melatonin. And they go out and they take about 20 different manufacturers' brands of melatonin and test them for purity. They test them for potency. They test them for product dissolution, meaning will the tablet dissolve in your stomach acid. And then they basically give it a stamp of approval if it meets all those things. Often they find that certain manufacturers' products don't. And so then they say, we don't recommend this. Getting access to this, you can actually access it. It's www.consumerlab.com. It's actually one of the next slides I'm going to show you right here, consumerlab.com. But the benefit of this website, it only costs, I think, $30 a year to be a member, and you get access to their product testing. You get access to a ton of good information that is referenced, evidence-based and referenced, about herb and supplement products. So there's monographs in there where you can read about products. And they also post health advisories. So, for example, that one product that had a Viagra derivative on it is something that was posted on Consumer Lab. The information related to the USP recommending warning labels for liver problems related to black cohosh and green tea extract was reported on consumerlab.com. So they have a lot of good information, and it's at a reasonable price. The other symbols, the NSF symbols and the USP symbols, also appear on products if the manufacturer has requested that they come in and test their products. So this is a little different. Here I'm contacting them and saying, come in and test my products. I really want to be able to put your seal of approval on all my products. And if they go in and they test it and they verify the same things, content, no contaminants, good manufacturing practices. USP also tests again for dissolution. Then they will get the stamp of approval and they can put it on their product. In terms of reliable resources outside of consumer lab, if you're looking at something on the internet or if you're looking at an advertisement, determine who's making the statement. A lot of products are sold solely based on testimonials. If you actually look at where consumers get information about supplement products, it is typically the #1 sources are things like friends, advertisements, family, and where doctors and pharmacists fall? We're like down there at about 10%. So, the people who are supposed to be giving you the balanced information evidence-based wise are not being utilized as resources. So it's very much based on advertisements, word of mouth, testimonials, and so you have to, if you're going to go out and use one of these products, you have to go out and determine, is it efficacious? So read about it. Go to consumerlab.com. There's other references. Natural Medicine's Comprehensive Database. This was actually, they did studies looking at what's the most reliable #1 reference for dietary supplement information. I use this all the time, and that's because I'm constantly getting questions about products, and some of them I've never even heard of them. And I go to Natural Medicine's Comprehensive Database, and it's in there. And they have evidence-based information, comes as an online format and also a book format. I'm a big fan of online in general in terms of information because it gets updated. As soon as you get a book, it's often outdated, right? And then it does rank the effectiveness of the claims. This is going to be more expensive, though, than Consumer Lab. And finally, Natural Standard, which really has emerged over the last 5 years as being a very reputable evidence-based resource, not only for consumers but also for healthcare providers. And this is their website here, www.naturalstandard.com, and you can log on to that and get information. And I don't know if I think they require a subscription as well, but I don't know how much it is. But they do a real good job as well in defining efficacy. So if you get asked the question, these are just things you want to avoid. If it sounds too good to be true, stay away from it. That's really what this slide says. And finally, tell your doctor if you're taking these products. If you have a side effect, report it to the MedWatch program at the FDA website. I say don't use them in children, pregnant or lactating women, because most of these products have not been sufficiently studied in these groups. And the risk sometimes, outweighs the benefit. And that's kind of the bottom line. It's just that we're still in a state now where we can't guarantee content. We can't guarantee that the product's going to work, but it is important that you still tell your doctor. And there are resources out there now for you to look at. So if someone asks you, does this work for this? Or which manufacturer is the best for a melatonin product? If that was asked to me, I would go to the Consumer Lab website and I would see what products has been tested. I might look at the USP website and see if they've, got verified products that they've tested. So that's how you can find a manufacturer. And then regarding information about efficacy or drug interactions, you're going to have to stick to the, Consumer Lab, Natural Standard, Natural Medicine's database. Those are really the 3 big ones in terms of finding fact-based information. So I'm really sorry I went over. I went over by about 10 minutes. But I really hope that you walk away with some good information.